or the Caribbean Public Health Agency. For further contact information, please contact the Ministry of Health for more info at 467-1172 or 467-1108. You can also be sure to follow the news to get the local COVID-19 updates. Let's all try to remain healthy and well. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA. If you own or work with animals, please follow these tips to avoid getting the coronavirus. Please keep pets away from areas where you are preparing food and eating your meals. Thoroughly wash your hands after handling animals and animal waste. Avoid contact with sick or stray animals. And always remember to wear protective gowns, gloves, and facial protection when handling them. As the novel coronavirus spreads, it is important that you continually disinfect your home. Viruses can gather on surfaces such as doorknobs, computer keyboards and mouse, cell phones, tablets, railings, kitchen and bathroom countertops, and remote control devices. To avoid transfer of viruses, wipe down these surfaces regularly with disinfectants such as Clorox, Lysol wipes, or soap and water. Avoid touching your face or your loved one's faces after touching any of these types of surfaces. It is very easy for viruses to be transferred in this way. When preparing food, be sure to use different knives and cutting boards for raw meat and cooked food. Wash your hands before and after handling raw meats. Also, wash your hands before and after using cooked food. Be sure to cook food thoroughly before eating it. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Parent registration for Flow Study. Step 1. Enter www.flowstudy.co. The Flow Study site should open. If it doesn't, go to www.google.com. Enter flowstudy.co in the Google search engine. Step 2. Click on the link that opens flowstudy.co. Step 3. Click on Get Started in the upper right hand corner. Step 4. Select Sign Up. Now enter your email address in the box provided. Step 5. Get started using your email. Step 6. Select Parent Account. Enter your personal information and click Next. Step 7. Create your password. Step 8. Select your country. Step 9. Link your account to your child's account by selecting Use Email. Step 10. Enter the email address given to you by the school and the password. Congratulations, you've just signed up as a Flow Study parent.
Extreme sadness and feelings of despair could be some of the things people are noticing in themselves during this unusual time. Pay specific attention to see if you have feelings of discouragement, hopelessness, irritability, difficulty concentrating, and disruptions in eating and sleeping habits. Pay attention to your emotions and talk to someone if they are feeling overwhelming. Focus on positive messages that you get from your environment. Listen to uplifting music, stories, or news items. Distract your thoughts by doing something like reading a book, doing a puzzle, coloring, or playing a game. Humor helps to lift moods. Watch a comedy or have a good laugh with friends. Remember your own strengths. What are some positive things that have helped you feel better in the past? Remember, if you have tried everything and overwhelming feelings of sadness still persist, reach out for professional help. This message comes to you from the St. Kitts Mental Health Association.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
So you understand what's going on?
Yeah man, it's easy.
Okay, cool. Alright then, look like you know what's going on.
Older children may need less supervision, but they need your full support. A few tips for assisting children with online or home-based study. Check in regularly. Ask questions about what they are doing. Don't shout or get frustrated if they don't understand. Encourage them to take breaks from time to time. Be affectionate. Be positive. Sometimes a simple touch goes a long way. As much as possible, provide a comfortable space for children to work in. You may want to be more lenient with the desired study location for teens. Encourage them to focus by minimizing distractions such as television, music, or telephone. As much as possible, encourage them to separate their eating spaces from their study spaces, minimizing the risk of damaging devices.
Is on.
A pleasant afternoon and welcome once more to the National Emergency Operations Center COVID-19 daily briefing for the 25th of May 2020. I am Les Roy Williams. We thank you for joining us again after we've had that break on the weekend on Saturday and Sunday, a well-deserved break Nonetheless, we continue to provide you with information with respect to the management of the COVID-19 pandemic here in St. Kitts and Nevis. We are still in a pandemic, even though we have all of our cases have recovered, we are still faced with the COVID-19 pandemic. As you can see all around the world, deaths continue to happen. People continue to contract the virus and so on. It is not over. And the management of the pandemic is absolutely important. And we are seeing that all around the world how political decisions are impacting on the management of the COVID-19 pandemic. We can look to countries, some closer and some further, to see how political decisions have either mitigated the COVID-19 pandemic or have heightened or exacerbated it. But here in St. Kitts and Nevis, we have done very well in terms of the management of the COVID-19 pandemic. The health officials and the government and all stakeholders have worked together, and they are to be commended in terms of the management of the pandemic, and all of society and an all of government approach. So thanks again for tuning in, because information, the providing information, the dissemination of information that is accurate and is timely and official information is extremely important to the management of the COVID-19 pandemic. We thank all the media who are partnering with us in terms of this management of the COVID-19 pandemic, by providing information, disseminating information, keeping all of society informed in terms of what they must do in order to protect themselves and to protect each other. Today I learned that in the Netherlands, 2 persons became infected with the coronavirus from a mink. That is in Amsterdam. And of course, you know, a mink is an animal that you grow for fur and so on. And you have animal to human transmission. That was quite an interesting revelation today for me. Without further ado, I would like to invite Superintendent Cromwell Henry, who is the Divisional Commander of District A, who will provide us with his report in terms of the regulations and how people are abiding by the regulations of the state of emergency. Superintendent Henry.
Thank you, Mr. Williams. A pleasant good afternoon to all. I'm pleased to be here this afternoon again after a short break on the weekend to present to you the law enforcement report on COVID-19 activities. Since we were last here, police have made 4 arrests of persons who were in breach of the curfew and persons who failed to wear their masks. So to date, we've had a total of 144 persons who were arrested for these offenses. Law enforcement continue to ensure the safety and security of residents in the Federation. This is evident by our latest statistics. In week 21 of 2020, the Federation realized a reduction of 76% in major crimes compared to the same period in 2019, and a 45% reduction for weeks 1 to 21 in 2020 compared to the same period in 2019. We thank residents for the part they played in this success, and we look forward for your continued efforts and support in this regard. This week, we will enjoy 7 days of limited operation days as the gradual easing of restrictions continue. However, the nightly curfews remain from 8:01 p.m. to 4:59 a.m. Monday to Friday, and from 7:01 p.m. to 4:59 a.m. on Saturdays and Sundays. There were some adjustments in the new regulations with respect to weddings and funerals, whereby in the past only 10 persons were permitted at these ceremonies. 25 persons can now attend, in addition to the officiating minister and other technical personnel. All persons attending, other than the bride and groom in the case of weddings, are required to adhere to social and physical distancing protocols, as well as good hand hygiene and proper sanitation behavior. There was also an adjustment to the hours of visit to public beaches. A person may visit a public beach between the hours of 5:30 a.m. to 10 a.m. for the purpose of swimming or exercise. There shall be no picnics, beach parties, or other gatherings, and all persons shall adhere to social and physical distancing protocols. Lately, we have been getting queries about restaurants serving dine-in customers, and we have seen some restaurants advertising dine-in service. The new regulations have addressed this. At Regulation 16, Sub-Regulation 13, where it states, during a day of limited operation, restaurants and takeaway food vendors may operate only for the purposes of food delivery or food takeaway services. The CMO has indicated that the task force will be meeting shortly with businesses in this sector to agree on protocols for the reopening of these businesses. So we ask that you please be patient and be guided by the current regulations. Businesses that operate as restaurants are only permitted to be open for the purpose of food delivery or food takeaway services. No dine-in. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to give us the Health Emergency Operations Center COVID-19 Situation Report for the 25th of May, 2020. Dr. Laws.
Good. Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, my task is to provide you the Health Emergency Operating Center Situation Report. The World Health Organization confirms that there are 5,204,508 confirmed cases of COVID-19 at present. Now, this represents an increase of over 200,000 cases based on our report on Friday. So between Friday and today, Monday, we've seen an increase of over 200,000 confirmed cases of COVID-19 globally. There are 337,687 deaths due to COVID-19 internationally, and this represents an increase of almost 10,000 deaths between Friday and today, Monday. I wanted us to pause on this slide The coronavirus emanated from Wuhan City in China in December of 2019. The virus traveled through Asia and then it went to Europe. In Italy, the virus impacted 229,000 persons plus to date. It has left over 32,000 dead in Italy alone. The virus then made its way through to North America. In Canada, 82,000 persons, over 82,000 persons are impacted. It has left a death toll of over 6,277 in Canada alone. In the United States, 1,568,000 persons impacted, and the death toll is now fast approaching 100,000. In Brazil, over 330,000 persons are impacted by the coronavirus. The death toll is over 21,000. The Caribbean is right in the middle. So you realize the virus is circulating around the Caribbean region. The data coming out of PAHO today tells us that in the region of the Americas, 81% of all cases and 84% of all deaths currently reported are from the United States of America and Brazil. And so I want to pause and tell, I want us to note that even though we do not have any cases here in St. Kitts, and even though the numbers are much lower in the Caribbean area, we are not out of the woods. We are still in the middle of the COVID-19 pandemic. In the Caribbean region, particularly 33 countries, areas, or territories, to date we have 23,168 confirmed cases, 10,000 of whom have recovered, and 796 deaths. Again, the Caribbean region is surrounded by territories that are seriously impacted by this COVID-19 outbreak. This coronavirus disease has caused unprecedented changes. The United States has halted some US $400 million funding to the World Health Organization. There's a rise in unemployment. Sports. Just yesterday I read Germany is calling their footballers of the two main football leagues to start practicing. They are thinking of, starting football without spectators. That's going to be interesting. We are seeing a rise in drive-in theaters, even drive-in church or worship. Healthcare workers are facing attacks as they travel to and from work. So these are just some of the unprecedented changes that we are experiencing because of this virus. All our lives have changed. At present, we have tested over 394 persons. 379 of these results have returned negative, 15 returned positive. Today we have no results pending. We have 4 persons in a government-assigned facility at present, and 815 persons would have been released from quarantine. Again, our 15 cases have all recovered. Okay, in our news bulletin this afternoon, we are going to talk about treatment, the clinical treatment of the new coronavirus disease. Sometime back in March, April, we would have heard that hydroxychloroquine, which is one of the anti-malarial drugs, seems to be beneficial in terms of the treatment of in-hospital patients, meaning persons who would have been admitted to the hospital for treatment of COVID-19. And so that was positive news. However, just a few days ago, the Lancet, which is a renowned journal, peer-reviewed journal in the medical field, they published a very interesting article based on what the scientists have found. They conducted a multinational registry analysis, and they found that the use of hydroxychloroquine or chloroquine is really not very beneficial or not beneficial to in-hospital patients who are diagnosed with COVID-19. In fact, they found that there's an increased tendency for cardiovascular complications when these patients are given hydroxychloroquine, and increase in the numbers who have died. Next. So in conclusion, seriously ill COVID-19 patients who were treated with hydroxychloroquine or chloroquine were more likely to die or develop dangerous irregular heart rhythms. And this is according to an article published in the Lancet a few days ago. Thank you.
Thank you, Dr. Laws, for that report. I would now invite Mr. Abdias Samuel, who is the chair of the COVID-19 National Task Force and National Disaster Coordinator at NEMA, to give us his report. Mr. Samuel.
Good afternoon, everyone, and welcome to another NEOC Daily Report. Today, 25th May 2020. I think the team would have had a good rest, so I'm hopeful that we can deliver for the rest of the week. When we continue to look at the particulars going forward, all right, we look at the calls, and we see that the calls have been reduced significantly. That is something good. The task force continues their work in accordance with regulations. Today they visited a total of 56 businesses and engaged a total of 8 buses. And an overview of the assessment, you could see the signs of progress in the physical distancing. Distancing markers in place is improving. Passenger buses continue to comply with the regulation, and I want to thank the associations and the responsible bus service operators for doing their part. And also the approach is working with the education and the revisits. I think the reinforcement continues to help in the molding of the desired behavior that we want from the bus operators and our citizens alike. The businesses, as we look at the particulars of the regulations in terms of distance, markers, and face masks being worn, even though we are seeing a drastic drop in persons not wearing the mask, I just want to remind you that wearing your mask is part of the regulation. It is important. It's critical that you continue to do so. In transportation, the 2 persons per row and also windows being partially open, and the sanitizing continues to remain steady according to the numbers. And the personal hygiene, again, continues. We have to reinforce these things because at the end of the day, when the second wave comes, these are some of the critical things that we will have to continue practicing in order for us to mitigate the impact of the second wave. Today, the task force would have carried out an assessment at the Ministry of Education Curriculum Development Unit at Lockhart Street, whereby an exercise is going to be undertaken by the Ministry of Education in giving out tablets. I think it's some 500 tablets thereabout. So we were there ensuring that the protocols and procedures according to social and physical distancing during the COVID or during this pandemic are adhered to. The exercise went very well. And I want to acknowledge El Alfredo for donating $500 to the fight against the COVID-19 or the COVID virus. I want to thank them that still we see the corporate partnership where businesses, the small businesses, are stepping up to the plate and doing their part. I want to appeal to our civic-minded citizens and all of our residents alike to continue to support the efforts as we mitigate the impact of COVID-19 on St. Kitts and Nevis. It behoves of us, as Mr. Williams was alluding to earlier, to act responsibly and exercise that civic duty that you need to ensure that we remain resilient against this pandemic. It will come a point in time that we have to open our borders. It's going to come a point in time when we're going to have to open up more, lessen the restrictions, and it's going to come that time where that second wave is going to arrive. What are we going to do when that second wave comes? And as we keep saying to you over and over, the second wave is going to be worse than the first. I can recall when we started this journey of preparedness to respond to this impact, person said that this will never happen, and we saw how easily it happened here in St. Kitts and Nevis. So let us remain steadfast, vigilant, and prepared to respond to that second wave when it arrives. I was able to visit the beach this weekend, and while visiting the beach, you saw that some persons were exercising the physical distancing, while others were just simply lapsing in carrying out their civic responsibility. For example, I saw a group of 10 individuals congregating together as if that everything is back to normal. We cannot approach everything as if back to normal. We have to prepare and be guided by the science and our medical professionals. So again, let me make that appeal to everyone to continue to remain vigilant in the fight against the COVID-19 virus. We look forward to later in the week. We want to visit a number of the high schools because we have fifth farmers and those who are going to be taking education and facilitate that process. That's one of our main objectives for the week. Again, please, our citizens, please again act responsibly during these times. Thank you, Mr. Williams.
Thank you very much, Mr. Samuel, for your report and for reminding us about our civic responsibilities. We now come to our question and answer segment, and I have one question for Superintendent Henry. Good afternoon. Superintendent has been providing a broad percentage of crime trending downwards. Can he provide the statistics for the individual offenses? That is the breakdown.
Thank you, Mr. Williams. I'll be happy to provide that breakdown. I mentioned I give statistics on, I will give the reduction, the total reduction for week 21 this year compared to week 21 last year. And for the major crimes category, homicides, there were 0 homicides week 21 last year, 0 this year. There was 1 non-fatal shooting in 2021. There was none this year. There was week 21 of 2019. Other bodily harm, well, wounding. There was 1 wounding last year, none this year. There were 2 robberies last year, none this year. There was 7 break-ins in week 21 last year. There was only 1 this year. 1 sexual assault last year, none this year. 7 larcenies, 5 this year. 4 drug cases, 4 drug possession cases, reports. There was none this year. 6 malicious damage last year, none this year. So that's a total of 21 crimes were reported in 2021 compared to 29 in 2019 compared to 7 in week 21 of 2020.
Thank you very much, Superintendent Henry. You are the fortunate one today, the only one who a question was directed to, and the only question for today. So we will bring this press briefing to a close for today. We recognize and thank the Honorable Wendy Phipps, Minister of State with responsibility for health, for her presence and for always being here to support the activities of the National Emergency Operations Center COVID-19 daily briefing. We thank Superintendent Cromwell Henry, Divisional Commander of District A, Chief Medical Officer Dr. Hazel Laws, and additionally, he didn't have any question today, but he's usually bombarded with a number of questions, our Medical Chief of Staff, Dr. Cameron Wilkinson. And we also thank Mr. Abdius Samuel, Chair of the COVID-19 National Task Force. We also thank Mrs. Michelle Christmas Jacobs for her dedication of sign language. We thank Ms. Vesta Southwell, who is here today as part of the Communications Task Force. We also thank ZIZ, who continue to work very diligently in bringing these daily briefings to us. And we continue to thank the media and all who work along with us in providing important and relevant information to the public in the management of the COVID-19 pandemic. We thank you for joining us today for this daily briefing. Tomorrow we'll be back at 5 p.m. for another daily briefing. Until then, to use the words of Mr. Samuel, continue to carry out your civic responsibilities and duties. And we know what those are, given the state of emergency and the pandemic which we find ourselves in. Take good care and see you tomorrow at 5 p.m. I am Lesroy Williams.
Is on.